Welcome to Infocular. Daily Dose 6 में आपका स्वागत है. Hope you enjoyed today's set of 5 questions. And your questions are: the correctly matched half-life with their corresponding radioisotope is technetium-99 9 hours, B. iodine-131 for 8 days, cobalt-60 for 30 years, and thallium-208 for 3 years. Now the correct half-lives of these corresponding radioisotopes are: technetium-99 is 6 hours, iodine-131 is 8 days, cobalt-60 is 5.2 years, and thallium-208 is 3 minutes. Hence the correct answer is B. iodine-131. Moving on to the next question. Cranial part of hypobranchial eminence gives rise to A. Posterior part of tongue, B. Posterior 1/3 of tongue, C. Epiglottis, and D. Thyroglossal duct. And the answer is posterior 1/3 of the tongue. Hypobranchial eminence is divided into a cranial part which gives rise to posterior 1/3 of tongue, whereas the caudal part gives rise to posterior most part of the tongue. For further details, you can go ahead and click the link mentioned below. Question number 3. A farmer comes with history of fever and flu-like symptoms. On physical examination, tender inguinal lymphadenopathy and ulceration in the leg is noted. What stain will help diagnosis of the bipolar stained organism? Now in this particular question, if you go step by step and you try to rule out a person with the history of fever and flu-like symptoms, along with inguinal lymphadenopathy, which is tender and painful, along with ulceration, you might reach up to the conclusion, but the trick lies in the last line, where they have secretly and very subtly mentioned a bipolar stained organism. This line itself is good enough to predict that we are talking about Yersinia, and Yersinia follows Wasson's stain. Wasson's stain is the stain required for Yersinia. Let's go ahead and see the explanation a little elaborately. If you look at the diagram 1, you can see a purple amorphous material. So when a blood film contains anthrax bacilli and is stained with polychrome methylene blue for a few seconds, after it is observed in microscope, a purplish coat of amorphous material is seen. This is called as McFadden's reaction, and it is used in presumptive diagnosis of anthrax. If you look at the picture number 2, this is a Zeal-Nielsen stain. The Zn stain is used for popular Mycobacterium tuberculosis, in which you can see the red-shaped rod bacteria. This was introduced by Paul Ehrlich, and this is an acid-fast stain. If you look at the picture 3, you can identify Corynebacterium. Albert stain is basically made up of 2 stains, that is toluidine blue and malachite green. Hence, it is a differential stain, and it is used to emphasize the metachromatic granules or food granules found in Corynebacterium diphtheriae. Picture number 4 depicts the Wasson stain, which is made of basic fusion methylene blue and ethyl alcohol phenol, and the microscopic procedure later depicts the Yersinia pestis, which is the safety pin appearance of bacilli identifiable on Wasson stain. This is due to the presence of the central vacuole. Hope the clarification is sufficient for you. Moving on to the next question. To health chart was given by A. David Morley, B. Ronald Ross, C. James Lind, and D. John Snow. And the answer is A. David Morley. David Morley gave the Road to Health chart, which gives essential information on growth monitoring of a child, एक child की immunization status, vitamin A supplementation, deworming medicine and other diseases. Ronald Ross ने plasmodium की life cycle बताई थी. Life cycle of plasmodium. James Lind gave concept about prevention of scurvy. And John Snow is the father of epidemiology, as you all know. So the correct answer was David Morley. Question number 5. Which of the following is not associated with hypothyroidism? A. Increased TSH. B. Decreased triglycerides. C. Increased cholesterol. And D. Decreased hemoglobin. Hypothyroidism affects lipoprotein metabolism. ऐसा देखा गया है कि with increase of TSH एक linear increase होती है in total cholesterol level, low density lipoprotein, triglycerides और linear decrease in high density cholesterol. Hence, the answer is decreased triglycerides. That's about it for today. Happy reading. In case you have any comments for us, any suggestions, any topics that you would like us to cover, or questions that you would like us to post, kindly go ahead and feel free to comment in our section. We'll be watching it. Thank you.